Hi, this is the old man with a fly rod. And this is totally off subject today for anybody that's watching this. However, I know a lot of you fly fishermen are going to go through cataract surgery or have. And also those of you that aren't tying flies may be interested in this video. I looked up a lot of videos on cataract surgery before I had mine, and I didn't see any that came across from a patient's point of view what their experience was like. And I had my cataract surgery 4 hours ago. And yes, the eye patch is here, and it's kind of a poly patch that kind of bowls out from the eye and doesn't irritate the eye one iota. And they'll take that off tomorrow at my follow-up appointment. Today was my first surgical intervention for cataract surgery. I have them both in the left eye and the right eye. I felt my left eye was worse, so they did that first today. And of course I went through all the preliminary stuff, and it wasn't very much at all. I went to one appointment with Dr. Larry Meyer here in Branson, Missouri. And he had his technician make all the measurements of my eyeball and everything to replace the lens. Now, I'm not going to get into what cataract surgery is. I just wanted to get into what my experience was like in having it. And the final line is they take out your old lens and then they just sneak in a new lens, and on you go with life. And I had heard from a lot of people that it was really worthwhile, and even my ophthalmologist, Dr. Meyer, said, your cataracts are at a 4+. And I thought, well, okay. And they had told me for the past 5 to 10 years that, yeah, you got cataracts forming. One of these days you're going to need them. So I went in for another reason for my eyelid not closing because of poison ivy I got into. And he looked at my eyes. He said, man, oh man, you got to get those cataracts taken care of. So that same appointment, he had his technician take all the measurements, because I'm sure the lenses are different concavities depending upon the size of the eyeball. And everybody has different size eyeballs, especially on the size of the person. So they took all those measurements and everything. And then, of course, I had choices of what kind of contact I wanted. Not contact, forgive me, what kind of lens I wanted implanted. And I said to him this question, and I highly advise you asking this question. I said, what would you do if I was your father? And then he said, you know what, if you were my father, and I just did it on my mom, I just did the ocular lens on you, and yeah, you possibly need, you will need reading glasses. Well, that's not a big deal. But if I'm going to see distance again like I used to, man, I used to be able to drive down with a car and I'd point out an owl to Chris, and she said, how did you see that? Well, those days are gone because of the fuzziness of my distance. So they went ahead and did all the preliminary measurements and everything, which took maybe a half hour. And then I was ushered into another office with another fine lady at this office, Missouri Eye Institute. She went ahead and scheduled me for 2 appointments. One was on July 1st, which was today, and the other one is on the 15th to have the second eye done. So 2 weeks in between having an eye corrected with the surgery. So I ended up getting the left one done today. Now I'm having a problem here. Come here. People want to see who you are, and you guys that are fly fishermen see her floating around on the floor where I'm in my man cave tying flies. So anyway, so I was apprehensive. The appointment comes up, and appointment's coming up, and it's coming up. I mean, oh, okay, it's a long ways off. Well, sure enough, within 3 days of it, I go, oh boy, I'm going to have somebody with something sharp going at my eyeball. Not too excited about this, but I heard from everybody saying it's well worth it and there's no pain to it, fine. Now, I'm a retired dentist, so you gotta remember, I deserve any pains I get. Actually, I was a good dentist and I was very cognizant of people if they were gonna feel any pain at all. We stopped and moved on to another way of controlling pain and taking care of the dental problem I was addressing. So anyway, I show up for my appointment this morning at 7:30, and here there were 3 people already there before me. I mean, well, you know, I had an appointment for 7:30, so after waiting to get checked in, there were 2 parties ahead of me that checked in, and then I checked in. And the old questions, you know, that they ask you, did you take food after midnight, which you're not supposed to, and did you drink anything, and all that stuff. And then they had me sit in the waiting room until the nurse called me back, and I sat there with Chris, and probably, I don't know, 30 minutes because of the fact that there were a couple before me. So finally they called me back after about 30 minutes, and I went back to room number 1, where the nurse now asked me all the questions like, when your eyes were bad, did you ever slay somebody out in the woods? You know, whatever questions they were. But just the general questions you get every time you go to the doctor's office. And did you ever notice when you go to the doctor and you go and you answer all these questions to the nurse and she writes them all down, and then the doctor comes in and he asks you the same questions without looking at what you just filled out? Anyway, I went ahead and answered these questions, and she says, okay, I'm going to be putting some drops in your eye now. This is the day of surgery, and she had me just put my head back in a chair like this, and she's putting in an antibiotic, she's putting in an anti-inflammatory, and she's putting in lidocaine, a pain medication dropped into my eye. And so, an anesthesia actually. And so, okay, she puts those in, and we get all done after about 20 minutes, and she says, I said, do you mind? I don't feel any different. And she says, oh, I'll put in a second drop for you. Little did I know they were going to be putting drops in me from that point on until they actually did the surgery. So they had my eye really numb. Did I feel numb? Not whatsoever. I had no idea my eye was numb. Other than this is interesting. I didn't feel like I wanted to blink with the eye I was going to get worked on. I had no intention of blinking, which had me concerned because how am I going to keep from blinking while they work on my eye? Well, anyway, she gets done with me and puts those on, and she said, now I'm going to take you over to your surgical bed. And they take me over to one of these surgical beds that they roll you around into rooms and stuff like that. And now they put an IV into my arm, just the needle, ready to accept medication, but no medication's put in yet. I didn't know that, and I hope you guys know this, that just because they put the needle in you doesn't mean that you're getting the happy medicine right now. That's not coming until you're actually rolled into the operating room. So anyway, then I laid there, and then I was there maybe 10 minutes. The hardest thing of the whole thing was laying there waiting for your turn, because now your bed is rolled into behind the next curtain into that cubicle, and then the curtain's drawn back, and then you're moved into number 1. And number 1 means you're next. Okay, fine. So in comes the anesthetist, and he says, here's what we're going to do. We're going to be injecting you with some Versad, and you're still going to be wide awake for everything, but mind you, you're not going to feel any sharp pains. Wait a minute. I don't want any pain. What do you mean I'm not going to feel any sharp pain? I didn't know we were giving gradations of the type of pain. But let me just give you a fast forward thing in here. There was no pain. It was a fantastic experience. So I'm laying there after seeing the anesthetist, and you know, the surgical nurse had come in. I'm waiting there more. I was probably 35 to 40 minutes from the time they laid me down on a bed until I'm taken to a surgical unit. And of course, now I'm thinking, wait a second, those pain drops that they put in my eye, they gotta be worn off. What are you gonna do now? So I'm laying there, and now get this. The guy next to me is probably an 81-year-old, and he's going ballistic. He's going, oh man, I don't know if I want this done today. What do you do to me now? Oh my gosh, I wasn't going to feel anything. Last time I was here, I didn't feel anything. Oh, this hurts. I can't do it. I'm going to faint. I'm going to throw up. And it's my turn next. I'm thinking, oh man, it's not going to be that bad. Hang in there. You've been through worse in life. So anyway, they now roll me back into the surgical room. And remember, I have the needle in here, and they've got an EKG going, make sure my heart's doing okay. And I'm thinking, I'm not having a foot amputated here, you know. But anyway, they go ahead and they roll me back in. And now this is a very bright room. And they had, by the way, they had marked my eye. Every time I answered the question, which eye are you having done? The left eye, right? And so they said correct. And anyway, finally, I'm rolled in there. And again, the question now, which eye are you having done, Mr. Sigris? And what's your birth date and all that stuff? And so I told them, and they went ahead and get me all prepped. And they're putting, blankets around me and things around my eye. And she's washing my eye really good. My eyelid and everything, I should say, forgive me. And my eyes closed, and they're just washing this eye and the surgical area really good. In walks the doctor. I couldn't see him, but I could hear him. I said, hey, Dr. Meyer, that's your voice. He says, you got me, that's me. And I'm thinking, wait a second, the anesthetist has him come first. So he left the room, apparently, because I didn't hear his voice anymore. And I'm way back, my head's back, but they went through all kinds of steps to make sure I was comfortable. They had something underneath my neck to make sure that my head, even though it was back, I was supported and I was totally comfortable in that bed. And then the anesthetist comes in and he says these words, uh-oh. And I'm thinking, I don't need to hear uh-oh. And I said that verbally. I said, oh, doesn't sound good. I'm not sure I want uh-oh. He says, oh, what happened is, he said, the computer screen went off. We got to wait for it. We rebooted it. I said, okay. I said, I'm a retired dentist. And I remember, one thing you never said in front of the patient was, uh-oh, as you're working on it. Or you never said to the patient, boy, this doesn't look good. So anyway, they went ahead and, excuse me 1 second. I'm just finishing a video. I'll be right there. I'll be right there. So anyway, he goes ahead and gives me the anesthesia, actually the Versed in my arm. And then came the psychedelic moment. I'm feeling good. And I'm wide awake, mind you. And then the doctor comes in because I've been prepped. The anesthetist is giving me stuff. They put more drops of lidocaine in my eye. And so I'm laying there and he says, okay, we're going to get started. And I thought, okay. But I couldn't care less. I'm feeling so, psychedelic with this Versed they put in into my arm. So as I'm laying there, he's starting to work on me, and I didn't feel a thing. In fact, it was far out and fun because I don't know if it was a laser light or what, but there was a white light, a white circle, a blue circle, and another red circle. They were almost kind of like rotating, and I'm watching these lights in there. And before I know it, he says, okay, now we're going to put in the new lens. And what he did is he took either ultrasonic or a laser and broke up the old lens. They just don't make a slit and then pull out the old lens, which is what I thought they did. But they went ahead and pulverized it with ultrasound and then rinsed out that whole area where the old lens was. I mean, really rinsed it out. In fact, my shirt was wet when we were done. So then after they got out the old one, I'm still in my psychedelic lights there watching. So anyway, now I sensed something. It's just like have your wife or your husband just push you on the arm. That's called tactile sense. You feel somebody touching you, but there's no pain to it. Well, the same thing here. When they put the lens in, you know something's going on, but there's no pain to it at all. And he puts that lens in, and he was real careful. I could tell he was moving it left or right. At least that's what I sensed he was doing. And he was getting it just in the right position. And then I don't know if they put cement on it, or I'll have to look it up. But that was it for him. I said goodbye. Now the nurse puts this puppy on top of me with some tape. And now they roll me on the bed out to a wheelchair. And I sit in the wheelchair, and he asked me, what kind of juice or pop I want? And he gave me something to drink. I was in that wheelchair probably, I don't know, 10 minutes at the most. And they said, okay, your wife is going to be around the side here, and we're going to wheel you there, and you can go home. And they gave me a printed out sheet of post-op instructions, which I can't have any pressure going on. I can't lift anything heavy. I can't bend down for a period of time. That's for today. Tomorrow I go for my follow-up appointment, and I'll let you know how that goes. But that's how my appointment was for the, in fact, I said these words as they were rolling me out. I said, I gotta be honest with you, that was kind of fun. And I don't know if they've ever heard that from a client, but that's how it felt. You know, I had a fun experience. I have no apprehension about the second one whatsoever. And I hope this helps you. And tomorrow, I'll make another video with the eye patch off. Let me just say this though. There's a clear spot right here. And I've been cheating by looking through that clear spot by closing my right eye and seeing what I see through the left eye. And remember, this is a blurred thing. I can't tell you how blue the sky is. Oh my gosh. In fact, my wife is calling for me because we're going to go buy some sunglasses. I have to go to the follow-up appointment ready to go with sunglasses, because the first experience you have when they take the patch off is how bright everything is. And so until your eye adjusts to that, you'll be wearing sunglasses. That's why I understand. So I'll give you a follow-up tomorrow when I come back after the eye patch. I hope this helps you. And really, it was a wonderful, wonderful experience. And that was only 4 hours ago. Okay, talk to you soon. Hey guys, this is my second day. It hasn't been 48 hours. It's been maybe 30 hours since my surgery. I just came back from the follow-up appointment and saw Dr. Meyer, and the technician took me back, and she took the patch off, which was no big deal. And then she asked me a couple questions, and then I sat and I waited. Oh, I know what she did. Yeah, she checked my vision, which was really kind of cool, because my left eye is now going to be my good eye, and my right eye still has to be done in 2 weeks. And so she had me, look through just my left eye, and then just my left eye, to see if there'd been any progress. And what I could read on the chart was really good compared to last time. In fact, I tried to read the chart with my right eye, which is my bad eye, and I couldn't come close to reading the lines that I read. And it's only been 30 hours since surgery. The other thing was, it's really cool, is that I can't tell you the blues color-wise that we're missing with cataracts, that when the cataracts are repaired, that sky is just a most celestial blue I've ever seen. And so then I waited, and the doctor came in, and then he put a little scope on me and gave a report for the gal to write down in the chart. And that was that the position of the implanted lens was good, and that there was some edema, and they give a number to it, like, I don't know, 1 to 4, and I had 2 as far as inflammation goes. Now, the only thing bothersome about cataract surgery is all the extraneous stuff that you have to do. Let me talk to my dog here. Bella, no. You go lay down now. Go lay down. No. So the extraneous stuff being 2 days before the surgery, I had to start drops 4 times a day. That I had to take these 2 drops. And I took them 2 days before the surgery, and then on a day of surgery, nothing. So now I go in today and I'm given my post-op instructions, and oh my gosh, not only do I have to keep doing these drops for 7 days, 4 times a day, but also they add a 3rd drop to it. And what are the purpose of drops? Well, the drops are going to keep away any inflammation, decrease the inflammation down to nothing, and as the inflammation digresses, your eyesight improves in that eye that you had the implanted lens put in, meaning cataract surgery. So I went ahead and put the drops in as soon as I came home. And when can I drive? Well, supposedly I shouldn't drive in the first 48 hours after the surgery. And, you know, I had Chris drive me there and back. And I'm not that good a backseat driver. You know, it just seems like my only eye I could see out of, because the patch was my right eye, and it looked like we were going to go off the side of the road, you know, every 10 minutes. But you know, that's me. I'm sure she feels the same way when I drive. So he also said, oh, this is interesting. He said, for reading and stuff, I'm not hurting anything by using my old trifocals. Now, I don't need them for distance anymore. I can pretty much see, and I'll see better when I get the right eye done also. But right now, it's improved my sight quite a bit. I told you everything about the drops. Can I bend over or lift anything? And you hear that saying that the first 48 hours you're not supposed to bend over or lift anything, because you don't want to increase the pressure behind your eye that could cause some damage to the implant that was put in your eye. And so they say after 48 hours you're pretty good, unless the doctor tells you otherwise. And he didn't tell me otherwise. Now, here is another cumbersome thing. None of this is painful, by the way. This is totally a wonderful situation, wonderful experience. As I mentioned yesterday, I do not take back anything I said yesterday. It's just the aftermath of drops, and then this. They took off the eye shield, which is, you know, just like a polycarbonate little lens that goes over your whole eye, acts like a patch. And then she hands it to me and says, oh, I'm thinking, okay, what's this for? Because we just took it off. She says, well, the doctor's going to want you to wear it every night now until your next appointment. I go, oh, no, because I wear a CPAP. And for those of you that wear CPAPs, it's fine. You put the shield on your eye, and then the CPAP just kind of sneaks under the leading edge of that patch. And it's fine. It wasn't that hard. That isn't what kept me up last night. I just didn't get much exercise yesterday, having to lay around. The eye shield. Can I shower and wash my hair? Don't have to worry about that one. But can I wear eye makeup? Not worried about that one either. And then, but can I shower? Do not wash your hair for 3 days, and showering just so you don't get your surgical eye wet, they say. And then on the back here it says, does it hurt to wear my old glasses? And the answer is no, especially if you're reading, and that's what I'm doing. Because I thought maybe they would want me to just get a pair of readers at Walgreens. They said, no, you know, you just go ahead and use your old glasses for reading. The only thing is, you're going to notice that your left eye is a little blurry in distance on these trifocals, and that's true. When can I get new glasses? Well, I got one more surgery coming up, and then after that, I guess 4 weeks, and I can get glasses for reading. But you know what? I'm finding out you can go to Walgreens now and just get a pair of glasses that you're just going to read with. Because otherwise, oh, and sunglasses. You got to have sunglasses. Well, that made a difference when I left the office today, because everything, as soon as they take that patch off, not only are the colors vibrant, but everything is so bright right away for your eyes to get used to. And when can I drive? I told you that. That is up to you as far as comfort after 48 hours. And I'm more comfortable when I drive. Can I rub my eyes? One big fat no. You can't rub your eyes. It's important not to press directly on your eye or anything for the first month after surgery. So that means probably until the end of August, I won't be able to really press or, wipe my eyes or things like that. Can you close your eyes and wash them? They say just wash it with plain water after surgery for the first week. And it's best if you avoid dust and things like that for the first 4 days of surgery. And I do woodworking. So even with goggles on, I think I'll pay attention to this and not do any woodworking for 4 days so I don't get any dust in my eyes. If my eyes hurt, what should I do? And of course you call their office. And the other thing they point out is that if you start comparing yourself to other people having it, everyone's different. And each doctor, just like when I was when I was a practicing dentist, I used medications for pain that other dentists didn't use, or they used things that I wasn't comfortable using. And so it depends on the doctor what he's going to prescribe. So don't go comparing, gee, my medications are different from your medications. Each doctor is different with their choices on that. One thing I was going to say too, as far as taking medications and stuff, oh, I know what it is, not comparing yourself to other. He was working on me, I recall this now. While he was working on me, he said, it's taking me a little longer to pulverize your old lens because it had such a buildup on it. It's probably like the calculus that builds up around your faucet that you have to clean off and how thick that stuff gets. I think it's the same thing with the eye lens. It just gets an accumulation over 77 years that it took a little longer to pulverize it. Is it a bad thing? No, it just it just took them a little longer to do it. And if you're younger getting cataract surgery, probably a 10-minute job. For me, it was probably 15 minutes total in the operating room. So I hope that helps. If you're interested, I'll probably throw in another 3-minute video afterwards in about a week and a half from now, just to see how the comparison is doing as far as my eye goes. He did say that as the swelling goes down inside the eye, because I don't feel any swelling, he says when the swelling starts going down inside your eye from the surgery, your eyesight will improve all the more. So I'm like, wow, this is really great. So the bottom line is, it was a piece of cake. It's just all the extraneous stuff you have to do that is not a big deal, especially if it's going to give you sight, that you're not wearing glasses except sunglasses when it's bright out, and maybe some reading glasses when you're reading, and that's it. Otherwise, see these trifocals? Bye-bye, baby. They're gone. And you know what? Walking downstairs now without trifocals, that's a biggie for me, because with trifocals, I get a little depth perception problem with those. Hitting a golf ball, won't that be nice not having trifocals? There are so many things I can think of. Depth perception, it's funny. I'll be going down the road, and before surgery, there was a branch way in the distance that hung over the road. It was way in the distance. And I thought, oh, I got a deer in the road. It was just a branch. So my interpretation of things in the distance should be more acute than they were pre-surgery. So I'll give you a report on that within about a week and a half. We'll add to the bottom end of this, and then I'll load this up for you guys. I hope it's useful. Just let me know in the comments. Talk to you later. Bye. Hey, how's it going? A lot has occurred since the last video that we did on this cataract surgery. The last time I talked to you, I was going through my follow-up appointment for the first cataract surgery they did, and everything was fine. And golly, I think I already told you how good things look. And then we went ahead and did the second cataract surgery 2 weeks after the first one. That was on the 16th of July. And everything went well. I would say it was painless. Maybe a little prick here and there, but you know, I mean, hardly any pain to that. And so I went ahead and then I had a 1 week follow-up after that second surgery. Now I got both eyes, and I mean, I'm seeing great. I could pick out a pig a state away. But anyway, I went ahead and did the 1 week follow-up, and they said my vision was 20/10 on both eyes. I mean, I was seeing great and feeling great. But then they said, well, let's see you in 2 weeks now after this. Okay, but I'm doing great. Well, sure enough, oddly enough, the very first eye that I did the surgery on started to get blurry. And that was concerning. And if I closed my left eye and just went the second surgery I could still see forever. But my left eye that I had the first surgery on, is really blurry and still is a little bit. And so I went ahead and I went in for my 2 week follow-up for both eyes. And I told them when they called, I said, be prepared. I said, because my left eye has been blurry. And they said, okay. So I went in, this was actually yesterday. Yes, yesterday. And they went ahead and tested my eyes and all that, and sure enough, my vision was way down for the blurriness on the left eye. The right eye, which was my second surgery, was still fantastic. So they went ahead and they did a scan of my eye. It's amazing the instruments they have today. And the scan is as painful as going in for your driver license test. I mean, you just look into a scope here, and they go ahead and this bar goes across you and it's scanning your eye. And it tells you, it actually takes a picture then of what's going on with your macula of your eye, where the surgery was done, the lens was put. And they checked my eye, the lens was right where it's supposed to be. I was worried about rubbing my eyes that I had displaced the lens or something, and I hadn't. But when they did the scan, sure enough, they found swelling going on in the macula, which was interrupting the sensors of fine-tuned focusing. And that swelling had closed up that little spot on my macula. And so they said that's not going to be a problem. We see this all the time. And what they did is, well, first they asked me, how did I do on the drops? And I got to be honest, on the first surgery I had, I was not diligent on the drops as far as the third drop, which is a prednisone. Make sure if you're having surgery, you follow the instructions. And I went off the prednisone way too early. And so when I went and saw him on my recall, he says, oh yeah, you gotta be back on that stuff. So I think it's because I wasn't paying attention to the drops, because the second eye that I had done, and it's perfect, I was very diligent on the drops. So if I have any advice for you, is make sure you pay attention strictly and stringently to whatever they tell you as far as taking these drops. And other than that, they said that'll take care of it. But they want to see me in 4 weeks or so. But they're pretty sure the blurriness is going to go away once that inflammation is gone on my macula. On the whole, I got to tell you, it was a great experience. And I'm going to tell you, to walk around and not wear glasses is just a delight. Now, I do use readers, because I chose the inexpensive monocular lens to go in there, which my insurance covered 100%. And I'm happier than anything. And they warned me, they said, no, that one's going to be distance only. You're going to go along great, but you'll need readers. I said, fine. So that's what we've done. Why didn't I go with a more expensive lens? I mean, it's my eyesight. Is that I don't know if the science is there. Maybe it is. You can ask your doctors as far as how dependable that is, having a lens put in that has fixed vision for distance and also fixed vision for watching, seeing things up close. Because how often did I have to change my glasses? Would I have to change the lens too after a while? I don't know. So I was real happy getting what I had done and ending up with readers when I need to see something close, like fly fishing and tying my flies. So thank you very much for tuning in. I hope the purpose of this whole thing is to give you a patient's point of view on how it went. And so thank you, and I hope this helps. Talk to you soon. Bye.